Breast Reconstruction Team is a team made of 3 consultants, and we have a lot of junior doctors working with us in addition to 2 breast care nurses. We have a secretary, and we have the whole ward to look after our patient. This team is responsible for treating women who had mastectomy or had breast cancer and they require reconstruction.
I had cancer for the second time, having had it 25 years ago. So it was a terrible shock. And I think no matter how confident you are as a person, that news can only be terrifying. The morning of my operation, when it's not difficult to imagine how frightened I was, Mr. Wilson introduced me to his team, explained again to myself and my daughter what was going to happen, explained that one of the team would ring her to give her information as soon as they had some, so that despite my terror, I felt that I was in the right place, being treated by the right people.
Whenever I was with them or speaking to anybody on the phone, I felt like I was the only one and I was their only patient, and that's what they made me feel like.
I know that if I had a problem or I was worried, I just ring them up and they'll either talk to me about it on the phone or they'll say, come in and we'll have a look. So that is good to know that somebody is there.
They really make you feel the best that you possibly can in a situation where everything's not perfect.
They just are all so good. I haven't come across anybody that I wouldn't say that about, really.
Everybody from the consultant surgeon through his team, including the anaesthetist, the nurses in the wards and the reconstruction nurses, the whole sense of a team working together, knowing the particular role that they play in the team and knowing the roles of everybody else and how they coalesce is really impressive and helps to ensure that what they hope for, which is the best possible treatment for each patient, can be delivered.
Energise is an exercise-based programme to help people who are going to have treatment for cancer, going through cancer treatment or recovering from treatment. The scheme has evolved since we launched it in May 2013.
It's a programme that's been developed with Everyone Active, with Macmillan, NBT and Bristol City Council as well, in order to provide some exercise for people to recover from cancer and their symptoms.
I was really low, I was really ill because I just had the chemotherapy, what drains you out. It really makes you ill. And I wasn't half the man I was. I lost a lot of weight and I couldn't breathe. With the 20 months I've been here now, it's unbelievable what's happened to me. They brought me on steady and steady, got me back to fitness. Exercise gives you self-esteem, it gives you good confidence.
I hadn't ever been to a gym before. I knew roughly what went on, but there was some apprehension of how it would go for me. However, that was very misguided because I found everyone at the gym very welcoming. It felt a very safe and comfortable place to be. And it really is one of the best decisions I've ever made in terms of my well-being for now and for the future.
It's really important to work within limits. Each person when they come in is an individual, so it's important that we treat them as such. So everybody gets their own individual programme to do. So where they may start at very low levels, just a simple case of walking or a bit of exercise bike, so some people might be able to do a little more than that when they first come in. Over the time they're with us, they'll progress to increase their time and their intensity that they're working at as well.
We've had some fantastic feedback since the scheme started. We've had people who have gradually increased their exercise and have gone on to doing regular walking programmes. We have had people who wanted to do things like the Race for Life.
The instructors are very passionate about the work they do, and I've found it hugely beneficial in helping me move forward.
The Move Makers were created for the opening of the Brunel building at Southmead in May 2014. We now have 120 volunteers carrying out this role 7 days a week.
It initially started for the move to our big hospital, and it was such a success that it stayed, and it is something that people comment about in many of the compliments we get and in what is good about coming to Southmead Hospital.
Well, in a word, we help. So that may be physical help, getting people from the gate to their destination in the buggy or in a wheelchair, or taking people up in a lift who aren't comfortable, or it may be practical help, getting information for people, guiding them through the check-in process on the computer screen, getting information about buses, directing them to places they want to go, or on a very human level it may just be contact with another person, a smile, a laugh, a chat.
Well, move makers are the first people you see when they come into the hospital, and they are just at the heart of helping people find their way about. When people come here, they're worried and anxious. They're greeted by a really lovely smiling face.
When I retired, I wanted to do something I could both enjoy but at the same time help others. I go home a happy person that I've helped others in their time of need.
It sets the scene for hopefully a really good experience here, and it also spreads the word that this is a good place to be, and I think it also encourages other volunteers to come, because they're a great team and they recruit each other because they have a good experience as well.